want to start, can you all hear me? By thanking you for the opportunity to speak here today. I'm talking about family impact today. And coming from a psychology orientation, I'm clearly going to focus more on the emotional impact that brain tumor survivorship has on the family. And specifically, I'm going to focus on a unit of the family that we don't talk about that much, and that's siblings. But something came up in our last session with the survivors that I wanted to really drive home and touch on before we get into the siblings. And that is, in our session, we were talking about work experiences, social functioning, and as part of social functioning, as has come up multiple times today, there are issues of social isolation, peer rejection, withdrawn behaviors, not being integrated with the peer group as you would expect. And in response to that, we asked the survivors, how many of you have symptoms of feeling down, feeling helpless, feeling sad, getting tearful about this? And almost uniformly, every single hand in that room went up. And I think that really speaks to the emotional impact of these social issues that have been touched on today. And although, like many of our previous speakers, I'm not going to have the answer for those social issues, I think it's really, really important for you as parents to know how central this emotional issue is to these survivors, and not only issues related to survivorship, but issues to being an adolescent in general, to being a young adult, transitioning through all of those developmental obstacles. And one of the things that the survivors brought up, and I think this speaks to their empathy, their sense to want to protect their parents, is that sometimes it's really hard to tell our parents when we're having a difficult time with these emotional issues. We don't want to burden our parents. We don't know how our parents are going to react. We don't know if our parents are going to understand. So what I really just want to encourage the parents to do is just to be there as supportive as you can, to reach out to your survivors if you feel, or your children, I'm sorry, to your children if you feel like they're down, and just to really recognize that this emotional impact that we talk about for the survivors, and I know Dr. Schwartz talked to some of you about this in the breakout session, this really is a true phenomenon that we see in survivors. Issues with anxiety, depression, as a result of social isolation, as a result of some of the cognitive changes, as a result of some of the physical health changes, which also leads to disrupted attainment of milestones. This is really salient in these survivors' lives. So just to make sure that you all are aware of that. And in addition, we also know that there's a significant impact on parents. Parents have symptoms of depression, anxiety, post-traumatic stress, again, their own sense of social isolation. So your new network becomes these other families of survivors, and almost losing that old sense of who was I before I got enmeshed in this cancer survivorship world. And then there's also this issue of caregiver strain. So there's a lot of extra demands put on parents when a child's going through treatment and during the course of survivorship as new health issues emerge, as new emotional issues emerge. And so really to be cognizant of the fact that survivorship impacts not only the survivor, but also the parents. And lastly, as an important component of that family unit is siblings. And this is really a group who we haven't looked at much either clinically or in terms of research. So what I'm going to do briefly is highlight what we know about how siblings adjust following diagnosis and treatment for cancer in their sibling. So I want to make this a little bit interactive. So when we think about siblings, you guys can just shout out, why do you think siblings might be at risk for having adverse outcomes? Why might siblings of survivors be at risk? They feel neglected. Guilt.
Jealous.
I'm sorry?
Jealous.
Jealous. Feel jealous.
You know, when they go on they think it's fun going to the play. They think it's fun going to the playroom and making something every week.
So they think their siblings having fun while they're going to treatment. Yeah. So not really understanding what goes on when they're at the hospital. They think it's more of a, yeah. Other ideas?
Feel less loved or cared for.
Feel less by the parent. Yep, more of that attention gets shifted to the survivor or to the patient. Fear of death of their sibling, absolutely. And I think these are some of the ones that we typically think about in the literature, but I think you guys hit these spot on. So they're exposed to and they witness a traumatic event. Their sibling is diagnosed with a brain tumor. They fear that their sibling's going to die. They see physical changes in their sibling, loss of hair, scars from surgery, not really knowing what to make of these. A lot of you hit on this, they're separated not only from their parents but from their other siblings during extended hospitalizations. Who becomes their primary caregiver? Is it an extended family member? Do they spend more time with friends? Loss of support from parents, and not intentionally by any means, but the attention gets shifted to the active patient during those times. Disrupted routines, parents aren't able to make all of the extracurricular activities anymore. The vacations that were planned get rescheduled. And then I think this becomes particularly salient when we think about survivorship, but this role of caregiving among siblings. So during active therapy, some of the siblings, depending on their age, may help out in terms of helping with other siblings or helping care for the patient. But then as survivors get older and some of the parents become concerned about what's going to happen when I as a parent am not here anymore, and where does that caregiving burden get shifted to? And does that get shifted to the sibling, and what are the implications of that? So when we think about sibling adjustment, and this context of post-traumatic stress has also been applied to survivors and parents, we think about it in this stress framework, the traumatic event being that the sibling is exposed to a life-threatening event through their patient, right? So they're very concerned that the sibling may or may not live. And that in response to that event, they have feelings of fear, they have feelings of helplessness, they're not sure what to do about it. And we look at three primary clusters of symptoms. So the first is re-experiencing. So in response to this event, do you continue to have intrusive thoughts about your sibling dying, your sibling not getting better? Do you have these intrusive, distressing thoughts that you just can't get rid of? And then do you avoid talking about it? Do you avoid thinking about it? Do you actively sort of disengage so that you don't have to think about this stressful, traumatic event? And lastly, we look for symptoms of arousal. So these will be irritability, having a hard time concentrating, having a hard time sleeping, being on edge or hypervigilant. So when I talk about sibling outcomes, this is the framework that's been applied to the outcomes I'm going to present. So what's the prevalence of these symptoms in siblings? As I mentioned, there's only been a handful of studies that have really done a good job of looking at this, and one of the earlier ones actually came from CHOP, and this was 78 siblings of children with any cancer diagnosis. So it wasn't exclusive to brain tumors, but there were brain tumor patients in this study. And the siblings were on average 14 years of age and about 5 years post-completion of the survivor's treatment. And what they found was that 32% reported moderate to severe post-traumatic stress reactions. 39% reported those re-experiencing symptoms, so thinking about it, not being able to stop thinking about it. 21% reported avoided having to think about it or feel about it, and 23% reported those hypervigilance, difficulty concentrating, or arousal symptoms. And in this study, they also compared siblings of cancer survivors to siblings of patients who were just going to a general doctor's visits. And they found that the prevalence of these symptoms were exceedingly higher in siblings of cancer survivors. And I just thought that these were some interesting findings that they also reported. And again, this is 5 years after treatment completion, that about a third of siblings thought that their brother or sister would die during treatment. 60% or almost 60% reported that it was hard and scary to go through the treatment of their sibling. And 16% believed that their sibling could still die from cancer. And so I want to show another set of findings, and the difference you'll note here, again, this was out of CHOP, but the siblings are slightly younger, and they're not as far off of treatment. The survivors are not. So it's just a year post-treatment instead of 5. And you can see that here we see 77% felt their sibling's life was in danger, and 48% felt those intense feelings of fear and helplessness after they found out their sibling had cancer. 60% had a moderate to severe post-traumatic stress reaction. And again, these numbers are slightly higher, but keep in mind that it's a shorter time from diagnosis and treatment. 90% had at least one re-experiencing symptom. 56% had at least 3 or more symptoms of avoidance, and 82% had 2 or more symptoms of arousal. And I think these numbers are really striking. So we know that most siblings adjust well, but we certainly know that there are siblings who are at risk for having adverse stress reactions when they're exposed to the traumatic event. And it's not that they're being diagnosed with cancer themselves, it's the trauma of their sibling, of another family member being diagnosed with cancer. And then lastly, 74% of siblings reported interference with functioning. And this is something that's really critical because when we think about making a diagnosis of post-traumatic stress disorder, and I do want to be clear, these are not diagnoses of PTSD, but when we think about that, one of the key things is that these symptoms not only have to be present, but they have to have an adverse functional impact. So they have to somehow interfere with your ability to do your day-to-day routine or carry out your activities. And they actually found that a third to just under a half of siblings reported that these symptoms of re-experiencing arousal, avoidance, were significantly interfering with their general happiness and their ability to gauge in and developmentally appropriate social behaviors. So what are some risk factors for sibling distress? Well, one, we know that just being female is a risk factor. And we know that in general, being female is a risk factor for experiencing greater symptoms of post-traumatic stress when you see males and females who are exposed to a traumatic event. And part of that is people have speculated that that may be because females are more empathetic and they get more on that emotional level, and so therefore they're having more of these post-traumatic stress symptoms. We also have seen, though somewhat inconsistently, that older age at diagnosis is associated with increased risk for stress symptoms. And the exact age cutoff is not clear, but what goes... Older age of the sibling, yep. No, thanks for asking. So part of that, what we think is going on there is, one, the sibling has to be old enough to be able to have a memory of what's going on, so to maintain these stress symptoms. And two, that they have to be old enough to understand the severe and grave, potentially, nature of the diagnosis. So there has to be a certain level of cognitive insight necessary for this to develop. And when we look at adult siblings, so siblings of adult survivors who are now 10, 20 years post-diagnosis, we see that survivors who have more chronic health conditions, their siblings are at greater risk for this very late post-traumatic stress. Survivors who, as young adults, have more distress themselves, their siblings are at risk for being distressed. And then another huge variable that we're really just starting to look at is this idea of family functioning. So how does the functioning of the overall family unit, family system, impact sibling distress? And there was a nice paper out recently, and essentially what this shows is based on sibling perception of how the family's functioning. So if the sibling perceives there's more conflict, there's poorer communication within the family, they don't feel as accepted by their parents, they feel that they don't have very much autonomy within the family, sort of the culmination of those factors increases risk for sibling distress. So it's not necessarily just a single hit that's going to make you at risk, but when you have multiple risk factors, you see an elevation in sibling distress. So now that I've started with that, I want to shift gears, and there's two things that I want to talk about the rest of the time. I'm going to end with talking about almost, I don't want to say the opposite, but the counter side of what I just presented. So I just talked about post-traumatic stress symptoms. I want to end with this idea of post-traumatic growth, but I want to talk right now about coping strategies, because what we know is how we cope in response to stress directly influences how we're going to adjust or what our outcome is going to be. And it's important to note that not everyone has a post-traumatic stress reaction to this, and how we cope may influence whether or not we have that reaction. So when we think about coping, stress and coping, in essence, something in our environment happens that we perceive threat from. So whether that's a diagnosis of a brain tumor, a breakup, getting fired from a job, something happens and you perceive a threat to yourself, either emotionally, physically, and that's sort of what the culmination of stress is. And in response to that stressful event, we have these cognitive appraisals that happen, and we develop potential responses, and then when we execute those responses, that is how we cope. So for example, child's diagnosed with a brain tumor, or you're diagnosed with a brain tumor. Your cognitive appraisal is, I need more information, so what do? You consult with doctors. So this is a very active approach to coping. From the child perspective, you get teased by your peers. Your response is, I need to stay away from those kids, so you stay at home with your parents. And I'm sure you can imagine that in response to any stressor, there are a number of responses you can develop, and then a number of things that you can execute in response to that. So your response may be, or you're teased by your peers. Instead of avoiding your peers, maybe you want to confront your peers, and maybe to do that you elicit the support of a teacher or a counselor. So there's a number of ways that you can respond to any given stressor. So thoughts and behaviors to manage stress is basically the essence of coping. And what's important to know about coping is that it's really a dynamic process. So it's not a static or single approach that you take to everything every single time. So every stressor is going to elicit different coping responses. No single strategy is best. Different strategies work for different people. And this idea of adaptive versus maladaptive coping is something that I don't really like very much, because a response to coping could be very adaptive in one situation and very maladaptive in another. So I think it's very context dependent. And it in part depends on both your emotional resources in terms of what you're able to execute at the time, and then did that particular coping strategy work for you in the past, or did it not? So what I want to have you all do, I guess I can go through these first before I have you fill it out, but there's handouts on your table that Stacia put out there, and it's a brief coping inventory, and this will just give you a sense of how you cope in general. So if you want to take Okay, so I'm close on time, so we won't fill it out, but essentially, when you guys fill that out, I want you to look at the ones where you endorse primarily 3s or 4s. And those are going to be the coping strategies that you use most regularly to deal with an identified stressor. The ones you use, the 1s and 2s you use less regularly. But what I want you to use this resource for is to know not only how you cope, but there are so many other coping strategies that can be applied to different situations. So I just had this up here for you guys to be able to go through after you filled it out, but I'll get you a copy, we'll get you a copy of this so you can see what the domain of coping is. So different methods include distracting yourself, denial, using emotional support, emotional venting or sharing your feelings, trying to positively reframe, using humor, accepting it, engaging more in religion. So there's a whole number of coping strategies, and it's important to know that when you're going through a stressful situation, there are many more strategies out there that you may not even be aware of. So now I'll transition to post-traumatic growth, and I'll wrap this up. So as I mentioned, in response to stress, we can certainly develop symptoms of post-traumatic stress following a traumatic event. But post-traumatic growth is another potential outcome that I think is really key to talk about when we think about survivorship. So this, essentially, what is post-traumatic growth? Well, it's going to be a positive change that occurs in response to a stressor. So it could be a change in your sense of self, in your relationships, in your philosophy on life. And it's important to note it does not have to occur in the absence of post-traumatic stress. So you can certainly develop symptoms of post-traumatic stress and at the same time or later develop post-traumatic growth. So in a review of the literature looking at post-traumatic growth in cancer survivors, there are a couple of main areas that came out. And I think I see these regularly in our survivors here, but a deeper sense or appreciation, valuing life more, gaining insight into yourself, skills, strengths that you didn't know you had before, a greater sense of closeness and family togetherness, and really a desire to give back. And I think we see that a lot with survivors in terms of the great fundraising you do, how you give back and volunteer. And in terms of quantifying this a little bit, a study of survivors' mothers and fathers showed in terms of positive effects that they perceived after going through cancer. So a positive effect with the way I treat people, the way people treat me, my plans for the future, how I think about life. And in this study, 90% of adolescent survivors endorsed at least one positive change, 85% of mothers and 80% of fathers. So this isn't an uncommon thing at all. In fact, I would say that this is more the norm than not, that going through a traumatic experience and then recognizing or growing in some capacity and having insight into that, years or several decades later. And then I don't want to leave out siblings. We started with siblings, we'll end with siblings. But there's also a high likelihood of positive sibling adjustment following diagnosis and treatment well into survivorship. So increased sense of responsibility, independence, maturity, having increased empathy and compassion for others. And overall, we see that 60 to 70% of siblings report positive gains or effects following cancer. So in sum, we know that survivors, parents, and siblings might experience post-traumatic stress symptoms. And we also know that there are important coping strategies you can use that influence your adjustment outcomes. However, I think historically we've really been focused on just the medical profession in general, this deficit finding model. So we want to know what's wrong, we want to diagnose the problem, we want to fix it. But what we've really missed with that, that approach is this idea of what benefit can come out of these experiences, and how do we best capture that, and how do we best relay to the survivors that there can be some true positive gains from this experience. And lastly, just to note that mental health professionals are available to help if you feel like your coping is not, to use the word I don't like, not adaptive, or if you feel like you don't have enough coping resources, just to help you identify some other ones. So thank you. Any questions?